Good afternoon. This is James Powell. I'm an AMMG certification specialist. I've had the privilege of working with AMMG almost 2 decades now. Thank you for taking the time to attend the webinar or play this back as a recording. I'll make sure you have my full contact information at the conclusion of this. I welcome a call. I welcome any questions. I've been, as I said, with AMMG almost 2 decades now. I know age management medicine inside and out. I feel not only the certification program, but how to actually do the business side of it, how to begin a practice, grow a practice. Those are some of the things I offer our graduates assistance with post certification. So any questions at all about that, a starting point, or if you want to discuss your future goals for getting involved from a practical application with age management medicine, by all means, let me know. In fact, in my full-time capacity, I'm also the VP of Practice Development with DocLoop. We actually have a symbiotic relationship with AMMG, and that is a platform that specifically focuses on how to grow these type of practices. I only mention that because, again, if you have any questions about how to obtain certification, attend conferences, or even what you would do post-certification, I would be more than happy to set some time aside and discuss all of these things with you. AMMG has been around more than 2 decades, or at least 25 years now. It was founded on principles of innovation. We are always advancing age management medicine and the latest in technologies, the latest in diagnostics, therapies, etc., is all part of our cutting edge training program and certification program. We all know that patients themselves are now focusing more on prevention. We also know that with the prevalence of chronic disease and all the things that happen with the aging population, we need to focus more on lifestyle, prevention, advanced therapies and diagnostics. Hormone replacement is certainly one component of many, many components that you'll learn how to do safely and effective. We really need more of you to keep up with the growing demand in this field. I'll go ahead and tell you right now, it's a common question. You do not have to be a physician only to go through this full certification. We train other clinicians. We even train people in the business side of longevity. We certainly train nurse practitioners, physician assistants, train chiropractors, etc., physicians, of course. Uh, you can go through this certification again, whether you're a physician or not. In fact, there's actually some cost advantages if you go through this and you're not a physician. We'll discuss that when we talk. You can earn up to 45 Category 1 CMEs. So why age management medicine? First of all, unless you're brand new at looking at this, you probably already know why you're looking at this. It is certainly the future of medicine. It's been that way a while. It's getting more like that all the time. I say this all the time. I've said this for 2 decades now myself, and it's as relevant now as it was then. The patient demand keeps exceeding the number of qualified clinicians in how to practice this type of preventive medicine. The good news is the patient demand is growing in leaps and bounds every single year. People want to get certain results. They've recognized the limitations in primary care. They've recognized the limitations in trying to go through their insurance provider. They're willing to pay for it. And people want to prevent disease. They want to stay healthy. They don't want to age like their parents and grandparents did. So any type of preventive technique, diagnostic test, lifestyle modification programs, etc., you'll learn all about that. And yes, there are even some financial incentives. Part of what I do at DocLoop, I won't really talk about it today other than mention that, is I have some models I put together, some tools. You can plug in numbers depending on the types of services you think about offering or do offer. It will even show you financial expectations on that. And it's pretty impressive, actually. It's not the number one reason why you should want to do age management medicine, but let's not kid ourselves. If not only your patients get far better clinical outcomes in this type of medicine, and you have a better quality of life, meaning you're not working 80 hours a week and on call all the time, and the financial incentives are there, it's not exactly a bad thing. When you look at some of these numbers here, including how poorly the aging population has been having to deal with chronic disease, when you look at the demand for cash practices, is the growth in it year after year, it's just staggering. You look at even just HRT, which is one component of longevity medicine and age management medicine. And again, there's many more aspects of it, whether you do HRT or not, but look at the growth in that. By 2030, 20% of the US population will be 65 years plus. Actually, this year, as of this recording, I will raise my hand. I'll now be in that category later this year. I've had the privilege, I think, and the good fortunes of being on my own age management program as a patient for close to 20 years now. I only trust my personal health and some family members' health with an AMMG certified physician. It's meant a night and day difference. Knock on wood, I'm not on any medications. I am on some HRT and supplements. I certainly adhere to a lifestyle management program put together by my AMMG certified physician, and it's made just a night and day difference in everything. The second number there says 76% in recent surveys, 76. So 3 out of 4 people prefer preventive health measures over reactive health. Again, this is something I've seen grow every single year I've been in this. It was a fairly small number from the patient perspective when I first got involved with AMMG almost 2 decades ago. I've watched this number grow every single year also, and that's a good thing. Patients, and you'll find in longevity medicine and age management medicine, if you're new to this, you're not already practicing age management medicine, you're going to find a completely different mindset with the types of patients you deal with. The patients not only get better, but they also listen to you. I find when patients are paying for something, they listen to what you're recommending. They adhere to lifestyle management. They adhere to nutrition programs. They begin exercising. There's some accountability. There's some follow-up. All of this you'll learn how to do in their certification program. Again, the market growth is there year after year after year. The advanced clinical protocols you see listed there, these are changing every year. Think about the advances in medicine year after year after year in a variety of fields. Certainly with preventive medicine, we know new therapies now, new diagnostic tests. We can even look at genomic profiles now, predict disease, therefore prevent disease. We can look at how someone's health is impacted by a less than ideal lifestyle. I mean, we know how to do these things now, and new tests are coming along all the time. Look at the advent of AI, even in our DocLoop platform. In my full-time job at DocLoop, it's AI powered. What AI can now do, look at AI. I think about head of our medical board, Dr. Pellerano, is a preventive cardiologist, how they've been using the power of AI to look at these scans in the heart. It can now tell specific things about plaques and all that that the original test could not do until recent years with the advent of AI being incorporated into these scans. So it's a very comprehensive curriculum. Every aspect of the medical component, the lab component, the diagnostic component, putting together personalized programs. So what are the actual components of the certification program itself? Well, there's 3 modules that I'm going to mention, module 1, 2, and 3. Module 1 is self-study. Now, you can begin module 1 once you apply for the certification, follow the steps, you begin the self-study. It's at your own pace. You can take as long as you want to do this. It's completely at your own pace. It's done online. You can log on and log off. So the good news is you can fit it virtually into any kind of schedule, whatever you're doing, because it is done online and at your own pace. I will say it is comprehensive. You have to take an exam, a competency-based exam at the conclusion of Module 1 in preparation for attending one of the live trainings, and you'll probably want at least a couple of months to go through that to be able to take the exam and all that. You can take shorter perhaps, but I would give it some time because it's a very robust course. First of all, you'll find it very interesting, fascinating. You'll learn so much from it. But you can take 6 months, you could take a year. There's no time stipulations on that. You must complete that competency-based exam. Module 2, once you have completed that competency and passed that competency-based exam, now it's time for you to attend one of the 2-day live interactive trainings. Now, typically at the very minimum, we will do one of these 2-day in-person expert-led trainings coinciding with either our spring or fall AMMG conference. Usually do the spring one in South Florida. We've done those for years there. And the fall one, actually, of this recording today, we're looking at doing one this fall in Las Vegas again. We've done them in various places. I think the first one I attended almost 2 decades ago was back in Las Vegas. We've done various ones, but anyway, at least those two. What happens on the main conference days are Friday, Saturday, and Sunday. We also offer several different workshops on Wednesdays and Thursdays of that week. Those are separate from the conference. You can look at one of those online if you want to attend one of those, pay for one of those workshops, go to those. But the main conference is on Friday, Saturday, and Sunday. So in the 2-day live training, you'll attend a Friday and Saturday in a separate classroom to go through that. Now, every one of these facilitators are experts. They all have very successful age management practices themselves. In most cases, most of these guys have done this more than 2 decades. So it is case study based, it's interactive. You will now put together everything you learned in Module 1 and start applying them to actual cases. You'll solve the problem, if you will. You'll start to put together programs. You really leave this 2-day live training feeling like you have the foundation to apply what you've learned next day in real world applications. That's what it's designed to be able to do. So this is, again, invaluable 2 days of live interactive training with actual case studies. Now, the Module 3 is another final examination. Now, this examination has a different focus than that first one. This is case-based questions. In other words, can you really apply everything you've learned to a real case and actually start treating patients? So it does have a different focus. It's case-based exam to assess the knowledge and the skills that you've learned throughout this process. So those are modules 1, 2, and 3. Ultimately, you do culminate with getting that nice diploma and certification. You can start implementing these age management medicine skills that you've learned effectively in your practice. You can expand your network, obviously. There is a great clinician network at AMMG. You're going to see in just a minute, we support your ongoing growth and ability to collaborate with your colleagues here by giving you some conferences at no additional charge as part of your certification. I'll talk about that specifically here in just a minute. We find it invaluable. I talk to physicians at every one of these conferences. Some of these guys I've been knowing for longer. They've been here longer than I have. I've known them for years and years. They continue to find it invaluable. Many of those physicians will be speakers, of course, or have been speakers. Many of these physicians have been past winners of the Mintz Award. Again, some of these I specifically recruited for DocLoop for that very reason of their expertise and long time experience in this field. But you'll want to keep being a part of the AMMG long after you completed those exams. What do you actually get at the conclusion of this? Well, you do get AMMG membership. You do get a 2-year membership thrown in as part of your certification. That's a benefit. Again, up to 45 AMA PRA credits, CMEs, for participating in all that and the ongoing conferences is part of this process that we give you, along with everything else I've mentioned so far. Again, the steps 1, 2, and 3 I mentioned. Online study at your own pace, the in-person live training, the final exam. Once you register for this and complete this process, again, that kind of sums up everything. Again, I want to point out a couple of things there. Notice at the very bottom, the package also includes a 2-year AMMG membership. If you go on our hmed.org website, you can belong or join the AMMG, even separate from this certification, even separate from attending conferences. So you'll see that's part of what we give you. But also, I want you to notice number 5 on there, and this is a recent change. We've actually added one additional free conference. You now get 3 free AMMG conferences. Now, depending on whether you're a practitioner or a doctor, and depending on when you register for a conference, I know there's some early bird discounts and all that. You may be paying $500 to $1,000 to register for one of these conferences. And as part of your registration package for certification, you will get 3 of these at no additional charge. Now, we'll say one of your 3, you're pretty much going to be tied up in that Friday and Saturday in a separate classroom going through your module 2. You could attend on Sunday if you wanted to, but you're going to be using most of that, one of the 3, on your own certification process. But then you have 2 additional conferences, whether that's the next fall, the next spring, the next year, etc. We feel that's a great perk that we throw in along with the membership to AMMG, but it just shows you how important it is. Of course, you'll get part of those CMEs as you attend these conferences as well. But I think that's a nice perk that we give out. There are other certifications out there. I'm not going to mention any of them by name. I've even attended some of those conferences just to kind of see what's out there. I think this is by far the most meaningful certification program out there, and one of the most common ones out there, with the biggest name. I'm not going to mention names. They're more than triple the cost of this certification. It's not a better certification program. It's more than triple the cost. Again, to me, it resonates loud and clear. While we have the most effective certification in age management medicine, in my opinion, I would love to have a conversation with you. Again, I know the field of AMMG quite well. I know the business side of it. I know what's required to begin these practices. I have some specific recorded training calls that I've done for DocLoop on the business side of starting this, that I also give AMMG certification graduates. I give them access to that completely separate from the DocLoop thing, but I just give that as a perk because I think it's important for you to have a next step once you get your certification in age management medicine. I'd be happy to speak with you about any of that. But again, specifically on the subject of AMMG and the certification, I invite you to go to the website, hmed.org. Now, I have not told you the cost of the certification yet. It is, if you go online, it gives you a cost, but it is less for non-physicians versus physicians. Also, if I get anyone inquiring through DocLoop with that symbiotic relationship, there is some perks that we give, that we give for DocLoop. And also, there are certain times, depending on when you inquire, that we might be giving a discount, and I'll offer that if it is applicable when we speak. But otherwise, you can get information online. You see my email address, jpowell@hmed.org. That phone number is my cell phone number. I welcome a text. I welcome a call. I'll get those periodically throughout the weekend. I don't mind at all. Someone will say they've seen something online, or research my name on Claude. I got one the other day like that. Or if you see a webinar or something like this, text me, call me, let's talk. I'd be happy to discuss your own age management medicine goals. Thank you again for taking the time today.